Okay, good morning. In this nice opportunity, we are going to talk about one of the randomized control trial that comparing between, I mean that re- to scrutinize the significant bleeding uh, between Ticagrelor versus Clopidogrel. It is the the clinical significant bleeding with ticagrelor versus clopidogrel in Korean patient with acute coronary syndrome intended for invasive management. As a background, owing to the differential propensity for bleeding and ischemic event with response to antiplatelet therapy, the safety and effectiveness of potent P2Y12 inhibitor ticagrelor in East Asian population remain uncertain. So it is, as I have mentioned before, it is to compare between ticagrelor versus clopidogrel in acute coronary syndrome and invasive management. This RCT called as TICAKOREA. As an objective of the trial, it is to compare the safety and efficacy of ticagrelor with clopidogrel in patients with acute coronary syndrome. With the study design, multi-center open-label randomized trial, population patient with acute coronary syndrome with or without ST elevation and intended invasive, and the endpoint for this clinical trial, it is clinically significant bleeding composite of major or minor bleeding according to plateau at 12 months, plateau, platelet inhibition, and patient outcome criteria at 12 months. And the method in this trial, in this multicentral trial, 800 Korean patients hospitalized for acute coronary syndrome with or without ST elevation and intended for invasive management were randomly assigned to receive one's ratio with ticagrelor loading dose 180 milligram, then proceed with 90 milligram twice daily thereafter, or in clopidogrel group 600 milligram loading dose continues with 75 milligram daily thereafter. The primary safety outcome was clinically significant bleeding as a composite of major bleeding or minor bleeding according to plateau, platelet inhibition, and patient outcome criteria at 12 months. And the result of this clinical trial at 12 months, the incidence of clinically significant bleeding was significantly higher in the ticagrelor group than in the clopidogrel group. It is about 11.7% versus 5.3% with hazard ratio 2.26. As a conclusion, in Korean acute coronary syndrome patient intended to receive early invasive management, standard dose ticagrelor as compared with clopidogrel was associated with a higher incidence of clinically significant bleeding. The numerically higher incidence of ischemic event should be interpreted with caution, given the present trial was underpowered to draw any conclusion regarding efficacy. Thank you.